Hi, everyone. Welcome back to Beyond the Dental Chair. I'm your host, Brittany Murphy, the myohygienist, your guide to thinking outside the box, expanding your skill set, and making a bigger impact on your patient's overall health. Today, we're diving into a topic that's common in kids, but also seen in adults and can have lasting effects on oral and facial development if not addressed. Thumb sucking and other noxious oral habits. So, why is it so important to break these habits early? How do they impact jaw growth and development? And what strategies can someone utilize, whether it's your child or even an adult, to quit for good? Stay tuned because we are going to unpack it all. Why do oral habits matter? So let's start with why habits like thumb sucking, nail biting, pacifier use, extended sippy cup use, tongue sucking, cheek sucking. I'm trying to think what else, hair biting. Why do these matter in the first place? For many children, these habits are soothing and there's a source of comfort, especially during stressful moments. But when they persist beyond the toddler years, they can interfere with proper jaw growth, proper dental alignment, and even the development of the airway. So here's the thing, your jaw's growth and alignment depend on balanced muscle activity. And thumb sucking, for example, puts abnormal pressures on the palate and the roof of the mouth. So over time, this can cause the palate to become high and narrow, leading to crowding of the teeth, improper tongue posture, and a reduced airway space. So when the tongue isn't resting in the right place, which is the roof of the mouth, this can impact things like breathing, speech, sleep, and overall facial development. What I found really interesting is when you think about why kids do these habits, right? They release endorphins, right? Serotonin, norepinephrine, acetylcholine. We do them, dopamine, if I didn't say that. We do them because they feel good, right? Well, getting that tongue back into the proper resting position, getting that tongue resting in the roof of the mouth can also help to turn on the brain and release those same neurotransmitters. And that is how we can utilize something like myofunctional therapy to help quit these habits. It's important that we understand a habit, right? If we're going to help somebody stop, we need to understand what the habit is. And more importantly, they need to understand what the habit is. So these are two really great books I recommend: The Power of Habit and Tiny Changes, Remarkable Results, Atomic Habits. We need to know the cue. So a cue is a trigger that tells your brain which habit to use and puts it into automatic mode. The routine is what acts out the habit. This can be something physical, mental, or emotional. A reward, right? We do it for a reason, right? It's the result of the routine, and that reward time after time is going to reinforce the habit. And craving, the feeling that the habit delivers. Another thing that I want to briefly mention too is when I have a kiddo or an adult, we tend to see these habits more in kids, but again, they do happen in adults as well. But when I see a kiddo like this come into the practice, one of the things first and foremost I want to rule out is any kind of airway obstruction, because what we're finding is it's almost like the body's way of helping to open the airway. Okay, it's going to get the tongue out of the airway. The tongue's going to come forward, the jaw is going to come forward to perform the habit, and that's going to help open that airway. So sometimes we see a correlation between kids that have these habits and have an obstruction, like, say, tonsils and adenoids. But regardless, as a myofunctional therapist, our role is to work on balancing the muscles, right? The muscles of the tongue, lips, and cheeks, correcting, optimizing oral rest posture and swallowing patterns, prevent long-term issues like TMJ dysfunction or sleep apnea. Of course, we're going to see changes in the jaw with these habits, even changes. Even habits like leaning like this. Um, I often find in my TMD patients, they don't realize it at first. Then I'm like, I want you to watch yourself for the next week, and I want you to see exactly, if you catch yourself doing this. Now, why does this matter, right? It's going to put a lot of pressure on the joint. Also, if you do this, like if you lean almost like on your cheek, you'll feel this cheek tissue literally sitting between the teeth. Okay. And then when we think about what these oral habits do, and we talked about how it changes tongue posture, it changes the balance between the tongue, the lips, and the cheeks, that's where we're going to see narrowing of those dental arches, insufficient jaw growth and development. And we know that the root cause of sleep disordered breathing or obstructive sleep apnea is underdevelopment of these jaws. As a myofunctional therapist, we are supporting holistic facial and airway development. So we have to eliminate noxious oral habits. So, what are some elimination program musts? I like to speak with the parent, give them a little bit of an insight to the program so nothing is like a surprise when I'm speaking with the child for the first time about it. I reinforce that there's never any negativity, no negative reaction. We're keeping it as fun and as positive for the child that we can. If there's any stress in the child's life, I definitely recommend postponing or not starting, changing schools, moving, death in the family, divorce. Review a habit questionnaire with parents. So I formulated a habit questionnaire. We're going to go over some of the items that are on there that I think it's good to get this information ahead of time if you can. And then you'll also discuss with the client or the patient when they do it and really try to get them to understand what their triggers are. Okay. These are really important. Bringing attention, you have to bring attention of that habit to the patient. When you conversate with the child, with therapy in general, they really need to trust you. So know their likes, know their interests, find a way to relate with them. Maybe you were a thumb sucker, tell them a story. Maybe your child was a thumb sucker. I always recommend when they're in your office, get on the floor, play with them. You don't want to be the scary person sitting above them. Ask them questions like, are you aware of your finger habit? Are you aware what this is doing to your mouth? Why do you think you do the habit? When do you do the habit? Maybe they don't do it at school, but as soon as they get in the car, the thumb goes in the mouth. Are you ready to stop? It's really important for us to be successful that the patient, at least a little bit, wants to stop this habit. So, our job is really to just help empower them by letting them know how much we believe in them and that we know that they're going to be successful. We know that they can do this. So, ask them, is it okay if I help you stop sucking your thumb or stop sucking your fingers or using the pacifier? And, rewards are always good. So let them know that prizes are included. Again, you want to keep it fun and engaging because this can be really scary. You're taking away that soothing, how they soothe themselves. And always get their permission. That's something that I learned from Sandra Holtzman. So, what are some strategies we can use to help someone break an oral habit? Because it's not always easy, right? But with the right approach, it can absolutely be possible. So, positive reinforcement, reward systems can be incredibly motivating, especially for children. So, use things like sticker charts or small incentives to help celebrate progress or milestones. Awareness tools. Sometimes kids don't even realize they're sucking their thumb, but products like thumb guards or reminders like little colorful bandages can help increase that awareness, right? Like they put their thumb to the mouth. Oh, wait, now I'm seeing this colorful bandage on my thumb. There's even like, what are they called? Is it digit? Fidget for your digit. Nope, that's the tool. Oh my God, I can't think of the names of the thumb stickers. Ah, it'll come to me. I'll post it in the group. But anyways, anything that you can use to help them. Behavioral alternatives like stress balls, right? Like take away the negative habit, give them something positive, but is going to also help soothe them, right? Or give them that same response that they're looking for. Emotional support. So identifying triggers, stress. Sometimes it's just boredom. Is it happening during bedtime? When is it happening? Once you identify those triggers, you can replace that habit with a healthier alternative, like hugging a stuffed animal, or maybe you can teach them a nice deep breathing exercise in and out through the nose, turn on that vagus nerve. Myofunctional therapy, of course. If the habit persists, it's usually a sign that there's underlying muscle patterns that need attention and have formed. So we can work on strengthening the lips, the cheeks, the tongue to establish that proper oral resting posture and eliminate the overall need for these habits, right? Turn on the brain, get those release of endorphins and neurotransmitters naturally in a holistic way. When we think about establishing correct roll rest posture, again, for anybody that hasn't listened before or doesn't know, that is tongue resting up in the roof of the mouth, tip, middle, and back of the tongue, lips closed or a confident lip seal, breathing through our nose, and having I can't speak, an adequate freeway space of about no more than 2 to 3 millimeters. So the space between our back teeth. We don't ever want to be clenched down. We don't want too much space back there. Through our programs, we're going to use fun exercises with this age group, especially to help strengthen muscles. So, fun things like blowing bubbles. People have bubbles in their house all the time, blowing bubbles, using straws to blow bubbles, using those silly straws. You can play lip seal games, fun tongue exercises. You can, interweave other games that they like into their myofunctional therapy exercises, like board games, Simon Says, things like that. So the way my program works is after 3 days, it's reward focused. So after 3 days of no sucking, they get a small prize. After 5 days of no sucking, they get another small prize. After 10 days of no sucking, they get a medium prize. And this is when I begin myofunctional therapy, typically for like my finger and thumb suckers. For other habits, tongue suckers, nail biters, cheek biters, I begin myofunctional therapy from the get-go because we have to get that tongue resting up in the roof of the mouth. We want to get that brain turned on, and have the natural release of those neurotransmitters. And I find that those habits are a little harder to break than thumb sucking and finger sucking. So I like to begin myofunctional therapy right away. And again, really helping hone in on what our triggers are, cues, having them really understand the ins and outs of their habit that they're performing. After 30 days is when they officially graduate, sucking, they're habit free and they get, I say a big prize, but I always say to parents, like, don't make it a big prize, like a new iPad, a new bicycle, because kids are smart and sometimes they'll do the 30 days, get the prize and go back to it. So I always say like an experience is fun, like a trampoline park or, maybe a little girl, mom takes them for like a little spa day or something like that. What will they need? So during the day, something to keep their hand occupied, like a fidget spinner. Fidget for your digit is a gold foil, like acupuncture ring. I love those. We use those a lot in our practice. Drawing books, anything that can help occupy, again, their hands or their mouth. Like you can make a paper clip necklace out of like a sunglass lanyard with a paper clip between it, and they're putting the paper clip between their mouth so their lips stay closed and the fingers can't go in. At nighttime, I usually do a tube sock or an ace bandage, whatever they need to decorate it. We like to decorate the sock or the ace bandage, give it a name, make it fun. Um, Large safety pins. So there are some programs out there that will teach this. I don't really ever utilize large safety pins. I know a lot of myofunctional therapists that do, and that's totally fine. It just kind of freaks me out telling them to put a safety pin on their child. So I usually bypass this step, but it is a pretty popular one to be recommended. So that they can pin that to the pajamas. So use that at your own discretion. And then other things, poster boards you can make like into a calendar to make a nighttime chart. Stickers, I love to give them stickers. They get excited to pick out their stickers for their nighttime chart in the office. Decorated and decorated boxes, fun boxes, special boxes. It could be a shoe box that they draw on or put stickers on, that they can keep their prizes in. Or sometimes we'll say, let's say that there's a blanket associated with a thumb sucking habit. Like we make a nice little box for the blanket. The blanket goes in the special box in mom and dad's room until we are done with our habit elimination program. So, like I mentioned, placing the tongue to the spot is going to turn on the brain. This concept I learned from Dr. Antonio Ferrante. So, I usually say to my patients, if you feel like sucking, pretend like you have something stuck to the roof of your mouth, like peanut butter, and try to get it off with your tongue. Other tips, let them know if they slip up, it's okay. There is no negativity. They do, however, need to start over with their chart. They can't keep going. The days do have to be consecutive. And then if the child starts with the other hand, we're going to put another sock or ace bandage on the other hand, but it's not going to be as fun. It's not going to be as decorated and pretty and all of that. So this program that I developed, I learned a lot from Sandra Holtzman's course or her method. You can buy her program. I think I have a picture of it somewhere, but you can buy her program on her website, oralfacialmyology.com. And then just over the years, a few little pearls that I've kind of put in there as well. So for our adult habits, again, we have to figure out the cue, the routine, and the reward. They have to create that awareness. What I'll have them do is keep tally throughout the day of how many times they're doing the habit so they can keep bringing attention to it over and over again. And that sometimes helps them figure out exactly when it is or what it is that triggers them to do the habit. As always, replacing the habit with something positive. Cut out as many triggers as you possibly can. Accountability partners can be good. So, as a myofunctional therapist, that can be you, where they're checking in with you once a day, like, hey, I didn't do my habit, or hey, I bit my nails 5 times today. They were all in the morning. I had a really stressful work meeting or something like that. Be confident. Make sure that they feel that they're able to do this. I love morning affirmations, so they can incorporate these. And then again, accept that there might be some slip ups. One of the other really important parts that I didn't talk about for the child's program is that accountability. I feel like that is a huge piece of it, right? It's different when grandma tells you to stop, when mom, dad tells you to stop. But when you have to check in with Miss Brittany every morning, you send me a text message and you let me know I woke up with my sock on. Oh, I woke up, my sock was off, my finger was in my mouth. Um, it's also just fun for them. Like they'll send me fun messages with like emojis and just like so proud of themselves. And I'm so proud of them and pictures of them with their prizes. But every single day until they are 30 days habit free, they have to check in with me in some way, shape, or form, whether it's a call or a text or an email. I can't emphasize enough the importance of early intervention. The earlier that we address these habits, the easier it is to prevent long-term effects on jaw growth and dental alignment. Plus, addressing these habits early supports proper airway development and, of course, reducing the risk of sleep disordered breathing. It's overall the umbrella term, right? So, mouth breathing, snoring, upper airway resistance, obstructive sleep apnea. So, please, if you're a parent, don't wait until the adult teeth come in to take action. And if you're an adult still struggling with the lingering habit, know that it is never too late to make positive changes. It's nothing to be embarrassed by. We are here to help you in any way that we can. And of course, doing that all holistically and what you're comfortable with and at your own pace. Um, Another thing that I wanted to say too, as far as I thought I had this in here, but I guess I don't. Other important musts for the program is when the child's going through it, they have to sleep in their own bed, right? So for at least 10 nights, they cannot sleep out. They can't have sleepovers. They can't, be in mom or dad's bed. They have to sleep in their own bed. Okay. No refined sugars before bed, at least an hour before bed. Another fun thing that you can intertwine into this is nighttime can be scary, right? Especially those first few days because a lot of kids will fall asleep with their thumbs in their mouth. So having something exciting to look forward to. So something like, having mom or dad go to the dollar store and getting a bunch of tiny little prizes and every night leaving a prize underneath that child's pillow so that when they go to sleep at night, they're excited to see what's underneath their pillow and it's not something that they're dreading, right? So anything that we can do, any tips and tricks, if anybody else has anything else to offer that they implement that works, I'd love to hear your thoughts. So reach out to me, post in the group. Typically, as long as that child is ready to stop sucking, you should be able to get them stop sucking on that day. If you implement this program, as we just said, there should be no reason if they don't have any external factors going on that we can't get these children to stop sucking almost immediately. So if you're seeing this as a registered dental hygienist, you have somebody in your chair, a child that mom says we just can't get them to quit their habit, collaborate with the myofunctional therapist. They will create a personalized guide for the child and the family to utilize to help support them and give them the tools that they need to really succeed and really help these children feel empowered. So, thank you again for joining. If you found this episode helpful, don't forget to share it with your colleagues, leave a review wherever you're listening. And as always, if there's a topic that you'd love for me to cover, let me know. Until next time, let's keep thinking beyond the dental chair. Take care and keep inspiring.